Hello, this is Dr. Jerry Law, Director of Family Education and Leadership Training for Meadows Behavioral Health Care. Thank you for watching this video on Family Week, what it is and what it is not. At all of our programs, we are committed to providing care not only for patients, but also for family members. One of the key components of this is what we call Family Week. While the option for Family Week experience may not always be applicable, many, if not most patients, will have the option to invite significant others to join us for a week-long experience that is truly life-changing. So I'd like to take a few minutes discussing what Family Week is and what it is not. First, let's discuss some realities. Not every patient that comes to our programs is able to participate in Family Week due to a variety of reasons. These include recommendations of the clinical team, length of stay, financial and logistical issues for family members, as well as the decision of the patient whether or not to invite others for this week-long workshop. So from this point forward, I will assume that you have been invited or that you anticipate being with us for Family Week. Now, each of our programs has a Family Week counselor, or in many cases, several Family Week counselors. These are trained specialists who will be with you and your loved one every step of the way through the process. Once you are invited, our team will send you the information that you will need regarding the exact dates for Family Week, along with a helpful packet of information that covers logistics such as hotel, motel data, maps of the area, restaurants and shopping, time of day that you will need to be on and off campus, and much more. This packet will provide nearly all the information you will need to plan and schedule your time with us. Now, it may be best to begin with a brief explanation of what Family Week is not. First, this experience is not family therapy, nor is it couples counseling. This is not a time to unravel long-standing family trauma, nor is it an opportunity for patients or their loved ones to unload years of hurt and pain on one another. The goal, rather, is to assist patients and their family members in learning as much as possible about the disorders they are dealing with, along with improved communication skills, healthy boundaries, and support for recovery. It may come as a surprise to you, so let me move on quickly to exactly what Family Week is. Let's begin with the format. Family Week is best understood in terms of a workshop. You and your loved ones will be involved in a great deal of education and have the opportunity to gain real insights into new and healthy ways to communicate, set boundaries, and share your truth. The workshop format lends itself ideally to this type of family interaction. As mentioned before, highly skilled family counselors will facilitate the process in order to ensure a smooth flow and to maximize your time with us. It is critical that you attend all days of the workshop, as has been or will be recommended by the clinical team. These workshops are carefully constructed in ways that each day builds upon the previous. We want you to receive the most benefit possible, and it is paramount that you plan for all sessions. We really don't negotiate on this one. Again, the purpose of Family Week is to assist families and significant others in becoming more aware of the dynamics operating within their own family. When families work together in support of one another, cycles are broken and intergenerational patterns of unhealthy behavior cease to occur. During your family program experience, you will have the opportunity to learn about addictive disorders, trauma, and family systems. We will help you better understand the need for and the skills of healthy boundaries and communication. We will give you tools to talk about the host of feelings that you are experiencing. you'll have a better grasp of what recovery and healing entails. We do this in a manner where your experience, vulnerability, and concerns are highly respected. Now, the Meadows experience over the years indicates that participating with loved ones in a structured family week experience not only significantly improves and changes family dynamics, it dramatically improves a patient's chance to make a strong, successful recovery. Now, for many of you, this may be your first experience with this type of week, and you may have apprehensions or even fear about the process in which you are about to engage. Please know, such concerns are not unusual, and our team is very adept in recognizing these concerns and helping you work your way through them. If you have not already heard a member of our team say the following, it deserves to be stated here. Trust the process. While this may seem outlandish to you, we really do hope that you'll take this recommendation to heart. Countless family members have come to Family Week with the same fears you may be experiencing and then leave extraordinarily grateful to have had this amazing opportunity to learn, change, and grow. Once again, we truly hope that you will trust the process. An important detail about which you may be curious is whether or not the Family Week program is identical at each of our programs. Well, the foundational design for Family Week is consistent between our facilities, and they are custom tailored to the specific population at each program. In other words, while the Meadows model is at the core of our Family Week program, specific educational and experiential components are carefully crafted at each location. Whether your loved one is suffering with a substance use disorder, depression and/or anxiety, sex and intimacy issues, eating disorders, trauma, or a combination of these or others, the Family Week program will take into account the unique characteristics of each of these disorders, as well as the age, gender, and other aspects unique to the population of that program. Having participated in the Family Week program at each of our facilities, as well as personally going through Family Week with a loved one who was in treatment, I wish to assure you that this is one of the most important things you can do for your loved one and for yourself.